Is it hormones or is it something else? If you're already on hormones or if you're thinking about starting, this episode is for you. First, let's start with something that should be really basic. It should not be controversial at all at this point, which is hormone replacement therapy is not a luxury. It's not something that you earn by being miserable enough. It's not about just hot flashes or vaginal dryness. At this point, we all should know that optimizing your hormones is one of the single most powerful tools we have to protect your brain, your bones, your cardiovascular system, full stop. The real question is, if you're already on hormones or if you're thinking about starting and you're still exhausted, foggy, inflamed, not sleeping, gaining weight, feeling like a stranger in your own body, how do you know what's actually driving those symptoms? How do you know that it's just hormones? Welcome to the Medical Disruptor, a place where well-versed women can ask the hard questions and get evidence-based answers you won't find anywhere else. Our community is always informed, empowered, and science-backed. I'm Dr. E, the NP with a PhD, and I help smart, well-versed humans go from medically gaslit to medically empowered. Guest episodes is when I sit down with clinicians who expand past their trainings, and solo episodes like this one is when I dig into one issue in depth. And you can find all my citations in the description below. So here's what I see every day. I see women go on hormones expecting everything to get better. And for some, it really does. But for many others, they feel a little better or not better at all. And then they assume that either their dosing is wrong, or the hormone replacement therapy isn't working for them, or that it's just aging and there's nothing they could do about it. And this is a trap. It's not that the hormones don't work. It's that the hormones are only part of the system. Let me make this real. If you're waking up at 2 a.m. every night, drenched in sweat and wired, that could be low progesterone, but it could also be your liver processing a glass of wine, which sends a glucose spike that then crashes and then kicks your cortisol right awake. If your brain feels like it's wrapped in cotton, that could be low estrogen, but it could also just be a mitochondrial slowdown because your fasting insulin has been creeping up for the past 5 years and no one ran a test. If you suddenly can't lose weight, yeah, it could be low testosterone, but it could also be chronic stress, flattening your cortisol rhythm, which is blocking fat metabolism, no matter how much testosterone you apply. And this is why some women go on hormones and feel incredible, and others go on the exact same therapy and feel almost nothing. It's not because hormone replacement therapy doesn't work for some people and works for others. It's because if you don't understand what's actually driving your symptoms, you'll be treating the symptoms out of order, and the system will stay a mess. So today's episode is not about convincing you whether or not to use hormones. If you're aging, the data is clear. You benefit from hormone replacement therapy. This episode is about learning how to build your case so that you and your provider can determine whether your symptoms are primarily hormone driven, hormone influenced, or actually being driven by stress, blood sugar, inflammation, sleep, or adrenal dysregulation. Because if you get it right, then HRT will work the way it's supposed to. Your brain will feel sharper, your sleep will deepen, your body composition will normalize. But if you skip this process and go straight to hormones without understanding your pattern, you will end up on HRT and still feel terrible, and you will blame the wrong thing. My goal for you today is simple. By the end of this episode, you're going to know how to run a 14-day hormone test that reveals whether your symptoms are responsive to hormones directly or whether your hormones are trying to work in a terrain that's completely out of rhythm. So this way, you don't walk into your doctor's office saying, I just don't feel right. Instead, you're going to walk in saying, here are the patterns, here are my triggers, here's what changed when I did X, Y, and Z. Based on this data, I believe that my symptoms are hormonal, or I'm ready to optimize both my hormones and something else, which we'll talk about. And that's the difference between hoping that someone takes you seriously and becoming the most credible person in the room, not just to the provider, but to yourself. Okay, let's do a quick refresher into what actually happens to our hormones with age. Okay, let's start with the basics, not the watered down version you get from Google or a pharma brochure. I want you to understand what's actually changing in your body as you age, because when you understand the patterns, you can stop chasing the symptoms and start recognizing the signals. So let's understand the hormone landscape of aging. It doesn't just start at menopause, PS, and by the way, it starts in your mid-30s, definitely into your 40s and 50s. Several key hormones start shifting, not all at once, not evenly, and definitely not predictably. Estrogen doesn't just drop, it fluctuates wildly. One day you have too much, and the next day you have none. This is one of the reasons testing is so difficult. And that instability is what drives mood swings, hot flashes, migraines, joint pain, and brain fog. Progesterone is usually the first to decline. This is your calming hormone. When it drops, sleep becomes shallow, anxiety creeps in, and you stop feeling like yourself. People will tell you it's just stress, but it's not. It could be low progesterone. Testosterone and DHEA, those also decline gradually in both men and women. These hormones are not just sex drive. They're critical for focus, muscle mass, metabolism, bone density, motivation. Low testosterone makes you feel like the brakes are on. Even when you're really trying, you just can't get up the hill. Let's not forget cortisol, which is our stress hormone. And it doesn't necessarily go up or down with age, but it does become irregular. You might be wired at night, exhausted in the afternoon, unable to recover from stress the way you used to. And then, of course, there's insulin, which does start creeping up silently in many of us. You don't feel it at first, but it's shifting your metabolism, it's causing inflammation, it's interfering with your sex hormone receptors. And that's why some women on estrogen still gain belly fat. It's not the estrogen, it could be the insulin issues. We'll talk about that in a second. But you can't rely on symptoms alone, because here's the part that many of us miss. Hormone symptoms don't belong to one hormone. They overlap, they masquerade each other, they stack. So night sweats, sure, it can be estrogen withdrawal, but it could also be blood sugar crashing. Weight gain can be low testosterone or high cortisol or insulin resistance, all three at the same time. Brain fog can definitely be low estrogen or poor sleep because you didn't sleep well the night before, or mitochondrial slowdown from glucose dysregulation. That's why so many women say, I tried hormones and it didn't work. And it's not that the hormones don't work, it's that the hormones can't override the imbalance. Hormones are not solo operators, they're a network. Think of estrogen, progesterone, testosterone, insulin, cortisol, and thyroid. I'm just not doing a deep dive into thyroid here, but it's worth mentioning. They're not individual switches. They're part of a control panel. Estrogen calms inflammation, supports brain signaling. But if insulin is high, those estrogen receptors stop listening. Progesterone definitely promotes sleep, but if cortisol is spiking at night, it overrides progesterone's calming effect. Testosterone definitely builds muscle and burns fat, but if you're under stress and sleep deprived, your body will break down muscle for fuel no matter how much testosterone you take. So if you start HRT without stabilizing your adrenals, your glucose, your circadian rhythm, you can be perfectly dosed and still feel awful. And that's the point of today's episode. Today isn't about figuring out whether or not you need hormones. If you're over 40, you care about your brain, your bones, your longevity, you're going to need hormones. Today is about answering the question, what system is blocking my hormones from doing their job? How do I find out? And that brings us to the heart of this episode, which is the 14-day hormone test. I was going to say protocol, but I hate the word protocol. So how do we run this 14-day hormone test? You're going to learn how to collect real-time data from your own body, not 200 pages of journaling, not a spreadsheet on Excel, just 4 simple signals scored once a day with 3 strategic micro experiments in it. So this way, you'll be able to walk into your next appointment and say, this pattern points towards estrogen instability, or my symptoms fluctuate with stress, not cycle. I want to look at cortisol. Or even with my estrogen support, glucose triggers my symptoms, and I need maybe insulin labs and metabolic support. This is how you stop guessing and start directing your care. Okay, the 14-day test. The 14-day hormone clarity protocol. Ugh, gross. The 14-day test. Let's figure it out. Okay, if you've been listening and thinking, I get it, hormones are critical, but terrain matters, systems overlap, I'm getting it, I'm hearing your E, but how am I supposed to know what's actually causing what? This is where everything changes. Again, most women are told to track their symptoms, which does nothing but create a diary of misery. We don't just want to track just to vent. We need to map it. We're not journaling our feelings, although that's important, but not here, not right now, not for this 14-day thing. We're collecting signals. And of course, the goal is not to diagnose yourself, right? I'm assuming you have a medical team and you're doing all those screenings and you're doing all the tests. The goal is to build a clinical grade case, just like any other medical case, that reveals what system needs support so that your hormones and your hormone therapy can do their job. Okay, now why 14 days? Because that's long enough to see patterns, but short enough to do rather quickly, right? Not 3 months, not a year. So you can really quickly get what you need to powerfully walk into the appointment. Okay, step 1, track only what matters. Okay, there are times when I tell people to do tracking of a lot of symptoms, especially my complex patients, my mold patients. But right now, we're not doing all that. We're really trying to figure out, is it hormones or is it something else? Okay, so once a day, 4 basic things that you need. Sleep quality. Did you fall asleep easily? Do you wake up through the night? and rate it 1 to 5. Hot flashes or night sweats, if that's applicable. 0 to 10 scale. If none, 0. If disrupted, give it a number based on severity. Energy stability. Rate your energy at 3 checkpoints: morning, afternoon, evening. Was it steady? Did you crash? Were you wired? And mood or brain clarity. Use a simple scale. 0 is foggy, 10 is clear. Okay, 4 things. If you don't like these 4 things, choose your 4 things, but 4 things that you think are hormone related. Optional, but super powerful if you could do it, is a fasting blood sugar upon waking. If you can wear a continuous glucose monitor just for this test, amazing. Would be great information. Again, optional. If it's consistently above 95, 100 when you wake up, you're definitely not just dealing with hormones, you're dealing with some metabolic issues. Okay, here's a commercial break that's not really a commercial break because I'm not selling anything. I made you a free guide that will show you exactly how to track patterns, document symptoms, and get taken seriously. I called it Build a Case. The skills you already use everywhere else, but now you're going to use them here. Click the link in the description to get your copy. Now back to the show. Step 2. We're going to layer in some micro experiments. Okay, we're not talking about big lifestyle overhauls. We're talking about a few experiments we're going to run to help us figure things out. Okay, like a diagnostic tool. They're, provocations. Like we're just trying to egg things on to see if we're getting the answer to the question. We're trying to figure out, is this hormonally driven or is it triggered by glucose, cortisol, or circadian rhythm? Okay, experiment number 1 on days 3 to 5. So 1 to 3, just collect your data. Just, it is what it is. Now, day 3 to 5, you're going to run your first experiment. No alcohol. Last bite of food is 3 hours before bed, and your meals are super protein forward with no desserts. What are you watching for? You want to see if your night sweats, if your heart racing at night, or your morning fog improve by 30% or more, right? So if day 1 to 3, your night sweats were a 10, and now you're seeing your night sweats at a 7, that's a 30% improvement. If day 1 to 3, your heart was racing at night, you did nothing else besides this alcohol, food, and protein forward meal, and now it went down to a 5, that's improvement, okay? So 1 to 3, you're gathering your basic baseline, no change information. Days 3 to 5, no alcohol, last bite of food is 3 hours before bed, and a protein forward meal, no desserts. And you're going to see if your night sweats, your heart racing at night, or morning fog improve by 30% or more, okay? If yes, then insulin glucose is heavily involved in your symptoms. Even if you're on hormones, doesn't mean you don't need hormones, but it means you won't get better if you don't fix insulin glucose. Okay? That's experiment number 1. Then on experiment number 2, you're going to add on day 6 to 8, you're going to do morning light exposure within 60 minutes of waking, preferably 10 minutes outside. I know it might be cold, get over it. No caffeine until after food. So you're not going to wake up and grab the cup of coffee. You're going to wait until after your first meal. And a consistent bedtime, wake time. Baby girls, we're talking 3 days, 6, 7, and 8. Day 6, 7, and 8. You could do this. I'm not saying forever. We're just doing an experiment. Nobody panic, okay? Morning light exposure within 60 minutes of waking. No caffeine until food. And then consistent bedtime / wake time, okay? What are we watching for? Does your energy stabilize? Does your anxiety drop? Did you fall asleep faster? If yes, then cortisol is a big driver in your symptoms, and it's something we need to address. If no difference, God bless. Cortisol is not a driver. Okay, experiment number 3. By the way, each one of these experiments are on their own. So whatever you did, you stop, you go back to your baseline. Experiment 3 is about progesterone. This is where we figure out whether your symptoms are really connected to progesterone. Or if they're coming from another system that needs support. So if you're already on progesterone, these 3 days are not about adding anything new. They're about testing your body's response to the progesterone you're already taking. So consider taking progesterone 1 to 2 hours earlier in the evening, and also consider, with the advice of your clinician, maybe taking a little bit more if you're not already at max. So if you're at 100, consider taking 200. So consider taking either your progesterone earlier or increasing the dose. And track how your body responds specifically to this area. Did you fall asleep faster? Did your sleep feel deeper? Do you wake up calmer? Do night wakings or heart palpitations improve? And does your anxiety decrease? If shifting the timing improves your symptoms, that tells us your body really needs progesterone and you're either taking it too late or you're underdosed. If there's no change at all, that's also still valuable. It means your symptoms are not driven by progesterone because it made no difference if you took it earlier. It made no difference that you took more. So then we know cortisol, insulin, inflammation, or estrogen are more the drivers and not progesterone alone. It tells us where to look next. If you're not on progesterone, you're not adding anything during this phase. It's very similar to days 1 and 2, but now you're observing your body through the lens of progesterone deficiency, right? The first day 1 and 2, we just kind of tracked all the questions that we have, but now you're going to track these symptoms really closely on these days. Trouble falling asleep or staying asleep, feeling wired at night even when exhausted, evening anxiety or irritability that comes out of nowhere. You know what that is. That's when you start a fight for no reason. Heart palpitations at rest, emotional sensitivity, crying easily or feeling on edge, night sweats that occur even when the blood sugar is stable. These are classic signs of low progesterone, not stress, not aging, not just how it is, progesterone. Okay, so if these symptoms are persistent or spike in this window, it's your signal that progesterone replacement is really not optional. It's not optional for anyone, but for you, it's definitely a missing tool in your system. This experiment with progesterone is super important. Progesterone is not just a hormone, it's your brain's calming agent. If it's missing, your nervous system stays in fight or flight mode, and no amount of magnesium, meditations, or sleep hygiene can help override a true deficiency. So this experiment really reveals if your symptoms line up with progesterone deficiency, or if we need to prioritize, as I said, estrogen, metabolic support, or cortisol first. Either way, you're not going to be guessing, you're gathering evidence. This brings us to day 12 to 14, which is the time of integration where your patterns become clear. These last 3 days are not about adding anything new. They're about confirming what your body has already shown you. This is where you move from those original, here are, I just have symptoms, to I have evidence. Okay, so you're going to put it together. So you're going to return to your regular routine. Unless one of the experiments was like so improved your symptoms, you don't want to go back, by all means, keep those. And then continue tracking your 4 key signals: sleep quality, night sweats, hot flashes, energy pattern, mood, or brain clarity. And now you're not trying to change anything. You're watching how your body behaves now that you know what levers affected it. So what you're looking for is trying to figure out which system is actually driving my symptoms: hormones, metabolic function, stress, or a combination. So here's what you need to ask. Did my symptoms rebound when I stopped experiment number 1? Then you know insulin's a driver. Did my energy go down when I stopped morning light? Now you know cortisol is involved. Did nothing meaningfully change until progesterone timing or dosing was helped, or if I just really focus on the progesterone window? And if that's the case, then you're progesterone deficient. Or did nothing change any experiment at all? Then you're likely in full hormonal decline, and you probably need HRT more than anything else on this list. So this particular phase, this day 9 through 12, it's not a cool down period. It's a phase where your dominant pattern should start to reveal itself. Again, you're not journaling symptoms, you're analyzing signals. You're gaining clinical insight into your own hormone terrain. By day 14, you're no longer asking, what's wrong with me? You're stating, here is what my body responds to, here is what it doesn't, and here is what needs to be evaluated next. This leads directly into your next step, which is turning it into a one-page case. Now, this is a game changer because you're not going to walk to your doctor's office saying, I don't feel right. You're not going to walk in with a binder or an Excel sheet because ain't nobody looking at that. I'm telling you that right now. What you're walking in saying, I tracked my symptoms for 14 days. When I cut sugar and alcohol, my night sweat improved by 40%. When I stabilized my sleep schedule, my anxiety dropped significantly. My fasting glucose is consistently between 100 and 105. Based on these patterns, I believe my symptoms are both hormonal and glucose mediated. And you could be like, hey, I'm going to be in charge of the glucose mediated stuff. I'm going to watch my nutrition. But hello, hi, I also need hormones, right? Or you could say, I'd like to evaluate my hormone levels, my estradiol, progesterone, but also can we take a look at my fasting insulin cortisol rhythm so I can optimize? So you're coming in knowing what you know, also willing to collaborate and partner. And it's not a complaint at this point, it's a medical presentation. And it completely changes what happens in the exam room. Now, this protocol matters whether or not you're on hormone replacement therapy. If you're already on hormone replacement therapy, this is how you discover whether your hormones aren't working because your dose is wrong or because your system is blocking their signaling. If your symptoms respond during the progesterone window, it's progesterone. If they respond during the glucose experiment, then you also have insulin resistance. And if they respond during the circadian reset, cortisol is involved. Look, in reality, it's never one thing, but this test will show you which lever to pull first. Once you collect all your data, you're going to turn these patterns into a plan, right? You've run your 14-day hormone test. You've seen which levers actually move your symptoms. Now it's time to translate the patterns into action. This is where you stop reacting to symptoms and just accepting them and start directing your care like the CEO of your own body. The decision map is not about guessing, and it's not about throwing supplements at everything. It's a clinical logic tree. This is what we use every time we diagnose someone, by the way. It's all a decision tree. Which systems do I need to support first? What labs to ask for? Whether HRT should be adjusted or accompanied by adrenal support or otherwise, and whether your provider is actually helping you or just managing you. You will know by putting this all into a plan. You have 3 possible patterns here. Pattern number 1 is when symptoms improve when you remove sugar, alcohol, or late meals. Your night sweats go down, your sleep improves, your mood stabilizes, your morning energy sharpens. What that means is insulin resistance or glucose variability is hijacking your hormone receptors. Even if estrogen is low, it still could be low, your cells may not be listening to the hormones you're replacing. So your next step there, the plan for this pattern, ask for a fasting glucose, fasting insulin, A1C. And if possible, ask for a test called HOMA-IR. That gives you a real understanding of your insulin resistance. All covered by insurance, by the way. Begin metabolic support immediately. Start intermittent fasting, strength training. If you need to, berberine is a great supplement. And if really needed to, metformin if your glucose is out of control. And then either continue or start your HRT because you need that anyway because of your age. Once the insulin is lowered and managed, your hormones will finally start working. If you replace the hormones without addressing the insulin, you won't get symptom relief. If you address the insulin and optimize your hormones, you will activate longevity pathways that protect your brain, your heart, and your body for decades. Pattern number 2 is when energy stabilizes with morning light and routine, or anxiety drops when stress is controlled. When you take a look and your best days correlate with a circadian regularity, you crash when stress hits, sleep is restless, despite hormone replacement. What that means is your HPA axis, your cortisol rhythm is dysregulated. Hormones cannot regulate in a stress-dominant environment. They won't work. So in that case, your next step is to request an AM cortisol or a salivary cortisol test if you have a provider that's willing to do it. You have to implement a circadian and adrenal support, which means morning light in the morning. I cannot overstress the morning light. You got to get out there, let your eyes, let your brain know it's morning time. Strength training early in the day. An important evening wind down routine, because when you have a wind down routine, it lets your brain know it's the end of the day and starts releasing melatonin and everything that you need to get a good night's sleep. And adaptogens if appropriate, ashwagandha, rhodiola. Hormones are still necessary, but without the cortisol regulation, they will underperform. A critical note to remember here is that in menopause, your adrenals take over as your backup hormone factory. If they're dysregulated, your entire hormonal symphony is out of tune. No matter how you perfect your HRT, if you don't manage this cortisol, you won't feel better. And pattern number 3 is symptoms that respond to progesterone timing or dosing. So if your sleep improves on day 9 through 11, anxiety drops, heart palpitations calm, night wakings decrease, meaning you have to start progesterone. Or if you're already on HRT, it might mean that your dose is not high enough. So your next step is to request progesterone replacement or an increased dose and optimize it, and also the timing based on your sleep and mood, not just the labs. And then consider retesting again in 8 to 12 weeks. This matters. Progesterone is not just a reproductive hormone. It's what's called a neurosteroid. It impacts GABA receptors in your brain, regulates sleep architecture, and protects against neurodegeneration, because if you've watched any of my episodes, you know that lack of sleep is causative for dementia. You have to sleep at all costs. There is a 4th pattern, which is absolutely no experiment made a meaningful difference. Your symptoms are a mess no matter what. It didn't matter which lifestyle shifts you did. You're a hot mess. It didn't make a difference. What that means is that you're dealing with pure hormone deficiency or inadequate dosing. If you've changed what you eat and you've changed when you exercise and you're seeing the morning light and absolutely nothing made a difference, it's still a great experiment, because now you know you need full hormone replacement, or if you're already on it, you need additional dosing. So then your next step is to Get a foundational HRT lab panel, estradiol, progesterone, free and total testosterone, DHEA, sex hormone binding globulin, thyroid panel, fasting insulin and glucose, vitamin D, and ferritin. P.S. And by the way, this list is not excessive. It's the minimum viable data needed to build a targeted hormone protocol, especially if you're just starting. Okay, so if this should be more than willing to give you these labs if they're going to be the ones replacing your hormones. So when you take your data and you make your one pager and you figure out your pattern, now you're totally walking into the exam room fully in control of where this exam, this visit is going, right? And now you're not asking for permission. You're walking in, directing your care with evidence. It's a whole different world. I just want to say that no matter what your pattern is, if you are a perimenopausal or menopausal woman, HRT still is really important. Optimized hormone replacement is not optional if you care about your brain health, because estrogen protects against dementia. Testosterone protects the white matter in your brain. Bone health, hormones regulate bone turnover. So if you're worried about osteoporosis, nothing else replaces this role. And cardiovascular health, your heart, when your hormones decline, it increases arterial stiffness, it messes with your cholesterol, it messes with your metabolic risk. So HRT matters for everyone. So it's not just about your symptoms, and it's definitely not about waiting until you're miserable. These hormones are preserving the systems that keep you alive well. However, when we're talking about relief from symptoms, we have to make sure that we're treating the whole network. The longevity piece comes from that HRT, your brain, your bone, your heart. The symptom relief sometimes comes just from HRT, but usually requires more personalizations to see which levers are really causing those symptoms. If you've made it this far into the episode, you're already operating differently than 99% of the people navigating midlife health. You're no longer just identifying and complaining about your symptoms. You're not chasing generic fixes or waiting to be rescued. You're building a case. You're directing the plan. You're stepping into medical leadership over your own body. And remember this, you are not here to be a good patient. You are here to be a credible authority on your own lived experience and pairing it with clinical logic. So recapping your next steps. Step 1, run the 14-day hormone test. Track daily your sleep quality, your symptom severity, your energy pattern, your mood, your clarity. Run 3 experiments, a glucose experiment, a circadian rhythm experiment, a progesterone window experiment. Look for 30% change in any direction. It doesn't have to be 100% I feel the best. 30% change in any direction. Did it get better? Did it get worse? Using your own scores. That's your clue. Step 2, identify your pattern. If you're glucose responsive, insulin resistance is blocking. If you are stress responsive, your cortisol rhythm needs work. If you're progesterone responsive, you need some progesterone in your life. If there's no response at all, you're likely severely deficient and need HRT without delay. And step 3 is ask for your labs. The foundation panel for anyone over 40 who wants to age with a brain, heart, and bone density intact. Estradiol, progesterone, free and total testosterone, DHEA, sex hormone binding globulin, fasting insulin and glucose, TSH free T4 free T3, vitamin D, and ferritin. Remember, these are not advanced testing. This is basic labs. And if your provider won't order them, that's your signal that you're in the wrong office. And step 4 is to take HRT with system support. HRT is essential for brain, bone, and heart, but if your system is inflamed, stressed, or glucose dysregulated, you won't feel the benefits. This is the part that no one explains, and this is why some of you on hormones don't feel better. Hormones are not magic. They are instructions. If the cells are inflamed, insulin resistant, or running on cortisol, they cannot hear those instructions. You don't need to pick between lifestyle and hormones. You need both. Hormones provide the signal. Lifestyle makes your body able to obey that signal. And this brings us to another episode of the Medical Disruptor. This is what disruption looks like. Not blaming, but exposing the limits of the training and pushing the conversation forward. You're part of a community that doesn't exist anywhere else. A safe space for people who want real scientific information, but also want to ask questions without being made to feel crazy. Our community is informed, empowered, and science-backed. Ready to go deeper? drafratlamante.com has my book, PDFs, newsletter, and a link for consults. Until then, keep asking questions, keep asking for more, and keep disrupting.